Hey everyone, I'm Patrick Jones, and welcome to episode 88 of That Gives Me Anxiety. Just had a handful of golden grams before this. And you know what? It holds up. Golden grams holds up. We always talk about movies, books, I guess books, I feel like a lot of people don't talk about books. Songs, TV shows, and whether or not they hold up. Nostalgic foods is another thing, right? Something might have tasted good as a kid and not so much as an adult. Like pixie sticks. It's just flavored sugar. Like literal sugar. That's it. That's all it is. But golden grams are good. I mean, it's just a simple... It's a graham cracker with a little extra sugar, and I just shoved it into my mouth, a handful of it, like a hydraulic press. Man, I'm having one of those days too where if you have contacts where it just, no matter how many times you take out and put it back in your contact, it just always feels like it's swimming. So if you look at the side of your eye, it's not covered by contact, right? It's blurry. You just feel it all day. Ugh, it's the worst. You take it out, you spray it, try to get it back in there. The same. I don't know what it is. I'm suffering. Hence the golden grams getting shoved in. Man, got a lot done over the last week, including plans for Jamie's birthday this weekend. Gonna rent a boat. Gonna go to a restaurant on the water. I think I did well with the gifts I got her. We'll see, I think the effort was there. So yeah, I got some things to look forward to too. But that's not why you're here. You're here to talk about anxiety. In this case, we're talking about postpartum anxiety. You've probably heard of postpartum depression, but postpartum anxiety is another aspect or another issue that people who have just given birth could deal with. Isn't that fun? I spoke with psychiatrist Stephanie Collier. I hope I'm saying that right. I don't know why I'm struggling with that last name. I want to make it Collier, but that's not right. Yeah, we had a good discussion about postpartum anxiety and what people can do if they're experiencing that, what resources are out there, and people who are supporting people going through that, like what they need to know and how they can help. But before we get to that discussion, I want to remind you, if you're liking the show, to please remember to rate and review it. You can check the show out on Facebook, Instagram, Twitter, YouTube, and Threads. Don't forget the Pure Spectrum CBD partnership I have, who offer the promo code AnxietyPod for 15% off. And if you're liking the show and you want to make a donation, you can through the Buy Me a Coffee link. It's in the description. Anything that you want to donate to the show is always welcome. Well, as always, thank you so much for listening and enjoy. Joining me now on the podcast, I have Stephanie Collier, who's a psychiatrist, and actually wears a lot of different hats that we're going to dig into here. Stephanie, thank you so much for joining me here on That Gives Me Anxiety.
Thank you very much for the invitation.
Yeah, this is so exciting. I mean, we're going to be talking about anxiety related to the birthing process or after birth or before birth. I mean, just related to pregnancy and bringing life into the world. And I feel like this isn't something that is discussed that often. It feels like it's a subject that, when you read about it in an article, it feels, they mention the statistics and how prevalent it is, but socially, we don't really talk about that. Why do you think that is?
I actually think we give a lot of attention to postpartum depression
Hmm.
and less so to postpartum anxiety. And I think of it more as a hidden disorder.
Hmm.
So a lot of times women don't know that what they're experiencing is severe enough to be an anxiety disorder. And so it's underdiagnosed because the women themselves might not be forthcoming or might not be aware that this is anxiety. And we also don't have great screening tools to pick
Hmm.
up on postpartum anxiety. Women generally are screened for postpartum depression, but they're not screened for postpartum anxiety. And so we're missing a lot of women. And
Hmm.
the epidemiology, the rates that we think, and this is probably an underdiagnosis, but we think about 1 in 5 women
Oh,
after
wow.
pregnancy may meet criteria for a postpartum anxiety disorder. And that's an anxiety disorder, not just the baby blues, not just sort of the changes in hormones
Hey,
and
I'm now a
anxiety.
mom, right?
No,
And I got to keep this child alive, right? Of course, there's going to be some anxiety, but yeah.
Yeah, so when we think of it as a postpartum anxiety disorder, we're thinking this is something that is more long-standing, so more
Hmm.
than just a couple weeks after birth, but really that it impacts how a person functions, really
Okay.
affects their life, their well-being, how they interact with other people, whether they can return to work or to school or to engage in other activities.
Got it. Yeah, I got a little ahead of myself here, and I wanted to give you a chance to introduce yourself to everyone in the audience and talk a little bit about what it is that you do.
Okay, so I'm a psychiatrist. I work in the division of geriatric psychiatry at McLean Hospital, but I also work in collaborative care, so working with primary care doctors in a model where a social worker, a mental health coach, and I get together to discuss patients in primary care, where we'll see patients 18 and older. And that's where I encounter patients with postpartum anxiety and depressive disorders.
Very cool. Yeah. You had mentioned something that I wanted to dig into a little bit deeper. It's known that there are hormone changes in the brain of a woman giving birth, and so you're saying that this is different than that. Do we know how much changes in the brain? Is it like
Oh,
it's got to be significant?
so when we think about pregnancy, the hormones that we're thinking about are estrogen and progesterone, and they
Hmm.
increase 10, 100 times beyond their baseline
Oh
during the
wow.
pregnancy process. After delivery of the baby, they drop down,
Hmm.
right down to their baseline within about 24 hours.
Oh
So
my
those are
goodness.
very large changes in hormones. And with that, we have changes in emotional well-being.
Hmm.
So it's not just in the delivery of the baby. We also know that there are changes in hormones that come with breastfeeding, for example. And we know that, for example, weaning from breastfeeding can result in worsening anxiety symptoms, not just the breastfeeding process in itself.
Man, I mean, that's insane that it just drops off that quickly.
And
I mean,
very, very rapid, very rapid. And that's part of what we think contributes to the baby
mhm.
blues, the
Yeah, I would
general sense
imagine
of
you have this
anxiety and
thing.
depression that people have in the couple days or even a couple weeks after delivery of the baby.
Wow, yeah. Can we talk? I know you've got a lot on your plate. You've got work, you've got friends, you've got family, pets, you've got the people that you make small talk with at the coffee shop or gym. You've got that bird that you see when you wake up every morning outside your window that you've projected things onto. Look at that bird. Doesn't even love its family. It's always by itself. You do that. Everyone does that. Point is, you've got a lot on your plate. Well, that's why there's Instacart, to take a little bit off your plate. Using Instacart, you search for all your favorite foods and things that you need from the grocery store, all online, all while you're looking at that bird, wondering why it hasn't called its mom. And they deliver it to you. They go to the store and do the shopping for you. And they can deliver it in as fast as an hour. And you can sign up by clicking the link in the description, wherever you're listening or watching. And that's a great way of supporting the show. So it's a great way of supporting this show. It's a great way to make your life a little bit easier because we all know that you have so much going on, like wondering whether that bird judges you back. So postpartum depression is mentioned so often. How did that get pushed to the forefront and postpartum anxiety sort of get left behind? Is it just that people don't understand that they are somewhat different, even though they kind of go hand in hand in times?
They do go hand in hand, and they often occur together.
Hmm.
So you could have both depression and anxiety. About half the people with postpartum depression will also have postpartum anxiety, but not everybody with depression will have postpartum anxiety, and the other way around. Not everyone with postpartum anxiety meets criteria for depression, but
Hmm.
very, very commonly they go hand in hand. Also, when we think about the diagnostic criteria, a lot of the symptoms overlap. So there will be changes in sleep that will happen in both cases. I think part of the reason that we're not as clear with how many women suffer from anxiety after delivery of a baby. And I also want to say postpartum depression, when we postpartum anxiety disorders, I don't want to just focus on the person giving birth because spouses and others raising children can also experience heightened anxiety and anxiety disorders in this period. So it's not just the person delivering the baby.
Mm-hmm.
But part of the reason I think we miss the anxiety is because the symptoms sometimes might seem at first normalized by society. Oh, you're worried about the baby because you're a new mom. It's your first time perhaps. Or you're worried about all these, you have new responsibilities. You're not sleeping well. You might be drinking caffeine to stay awake. There's so many other contributors that it there might be another explanation. So very often women don't notice that it's something else. It's something a little bit more severe. And it's hard to know at what point is it too severe.
Mm-hmm.
Mild symptoms aren't an anxiety disorder. That might be an overdiagnosis too. But I think as a society, we just don't use the term postpartum anxiety or peripartum anxiety disorders as often as we use depression, even when non-professionals are speaking. And we don't screen. And I think not screening for the anxiety disorders gives us an opportunity to miss women who could benefit from more support.
Is that a lack of resources, or is that just it's just not on the menu, so to speak?
So we have screening tools, but it's not part of the protocols.
Hmm.
Right now, the standard protocol after delivery of a baby, there's checking in with the mom during the newborn visits. And then a woman will have one appointment generally, if it was an uncomplicated delivery, 6 weeks after delivery of the baby. And that's when she'll get one screening question for depression.
Oh, wow.
That's the extent of the medical involvement for the person who gave birth.
Oh my goodness. That's very similar to I've interviewed a bunch of people who have been in the military and then come out, and it's you get one point in time, and it may not necessarily be presenting at that moment. It's too much stock placed on one moment, right? You'd be like, oh, I kind of feel fine here. We had a good interaction. I feel okay. Then you go home and you slink down a bit.
Yeah, yeah. And also the time point. 6 weeks is a long time.
Hmm.
Even if you do pick up on it 6 weeks later, by the time you start treatment, if treatment's needed, it takes a few weeks. It might take a couple months to get to maximum response. And so there's a little bit of a delay there.
Right. So you mentioned the symptoms of this in both the person who gave birth and a partner who is supporting that person. There is that caricature that you're describing of like a woman in a bathrobe, strung out on coffee, holding a baby, tense and nervous. But so how do you begin to look for someone who's struggling with postpartum anxiety?
As a clinician, I think it's really important to ask specifically about anxiety symptoms.
Mm-hmm.
If you ask, are you feeling sad or down or depressed, you might miss it.
Mm-hmm.
So the way that I think about sort of quick screening questions, just asking, are you worrying a lot? Because that's really sort of the main sort of telltale sign is the excessive worrying.
Mm-hmm.
Are the worries keeping you up at night? Not that you're up at night anyways, but because of the baby, but are the worries really preventing your sleep as well? Are you having physical symptoms? Is your heart racing? Is it hard for you to breathe sometime? Do you feel nauseous? Anxiety doesn't just present as worries, it can present as panic attacks. It can present as behaviors as well. So you can ask about how often are you checking in on the baby? Do you have any behaviors that are interfering with your daily life? Some women, and a minority of women with postpartum anxiety, but some do develop obsessive compulsive disorder or symptoms that are almost as severe as obsessive compulsive disorder, where they're checking in on the baby all night long and not sleeping because of that. They're watching the monitor 24/7 as often as they can. They don't trust giving their baby to someone else to hold, for example, because they're so worried. And in a small percentage of cases, the women are actually worried that they will harm the baby. And these are thoughts that they don't want to act on, but they're thoughts they can't get rid of. They're sticky. And those can be very, very interfering in their daily lives.
Yeah. Well, especially at that point in time, it's very understanding like the anxiety, of course, right? It's everyone's going to be anxious to a certain point, and also you hear about SARS and things like that. I can imagine how easy it is to fall into that loop. I mean, SARS is extremely rare. I mean, I'm not sure if that's
Are
something
you
that you
thinking
feel comfortable.
SIDS?
SIDS. Oh my gosh. Yes. Oh my gosh. Thank you for correcting me. Yeah. Bozo move there. But yes, SIDS is such a terrifying thing that, like, if you put the baby down the wrong way, or you're right, it's just this omnipresent danger. And how prevalent is it? Is it
SIDS is a rare
extraordinary?
event.
Yeah.
And also for the listeners, that's sudden infant death syndrome.
Yes. Thank you.
So this is the biggest fear for a lot of women is that they go to check in on their baby and the baby is not alive anymore.
Hmm.
And the causes we don't really know. We know there's a couple risk factors, smoke inhalation or smoke in the house, and babies who are, on soft bedding and with pillows. But that's a big fear, and it's actually having lost a child before is one of the biggest risk factors for anxiety disorders in the postpartum period.
Mm, yeah. So someone's experiencing or a partner recognizes this in someone else. How do you think the best way to help them? Is it suggesting that they go see someone? I mean, it can also feel like a hurdle just anytime that you notice a friend having anxiety, suggesting to them, maybe I'll go with you but people sometimes resist going to
Mhm.
get help. Do you have any advice for helping someone get the help that they need?
That's an excellent question. I think it really depends on your relationship to the person
Mhm.
and what the level of trust is.
Mm.
Basically, the one thing you want to refrain from doing is necessarily giving advice or saying, go see someone. I think the very first and the best thing that people can do when supporting someone with perhaps anxiety is to listen. Listen to what they are saying and be there as a support just to listen, not to judge, not
Mhm.
to offer any advice. And that's so hard to do, to sit with someone because you want to often think of what can we do to help a person, but actually just being present with a person is very helpful.
Mhm.
We know also that anyone who has a newborn is probably not sleeping very well because they have to feed the baby, or
Mhm.
someone else in the household has to feed the baby. So anything you can do to just give a little bit of extra sleep, whether it's offering to do a feeding with a bottle once a night or letting someone nap during the day, that's extremely helpful because we know that the sleep deprivation just makes anxiety worse. If it's not a
Mhm.
trigger, it exacerbates. So
Right.
really helping with sleep, but not just sleep, helping out. So besides listening, helping with sleep, really helping out making food, doing chores in the house, cleaning, going grocery shopping. Those are probably the most effective interventions for giving someone a little bit of a break.
Yeah.
In our culture, sometimes a person who delivers a baby is also the one who's cleaning or shopping or preparing food. And
Mhm.
so helping out in those ways, it's very hard to ask for help for many, many people who are suffering, especially people who are suffering from anxiety disorders. So being active, what can I do, can be helpful. Or giving a couple options. Is it okay if I? Because that way it's not making the person with anxiety think about what would be helpful and having to
Mhm.
ask for help, sort of jumping in and just doing it. If you think a person, though, could benefit from seeing a doctor, then you can always throw out, in your menu of options, would it be helpful for you if we saw your doctor? Or
Mhm.
if I drove with you a little bit or watched the baby, if you wanted to check in with someone. To find help, you don't necessarily have to go in person. Sometimes just having an hour in front of a screen, you can talk to someone. There's ways of delivering care now that don't involve getting into a car, bringing a newborn, and going into an appointment.
Yeah, that's all great advice. Thank you so much for that. When someone comes to you and is experiencing this, or the team that you work with, how do you begin to help that person? Just to try to show people what it might look like. Is it explaining what's going on in their minds? I mean, because people may not have anxiety and the tools to handle it, and now all of a sudden they do, and right, and that could be terrifying, right? Like, what's wrong with me?
Yeah. I think that what's wrong with me is probably the most important point because we don't want to overdiagnose and we don't want to miss. So,
Hmm.
really getting that history. We know that women who have had an anxiety disorder or depressive disorder during their pregnancy, about 1 out of 3 of them will have a postpartum anxiety disorder. So we can have a couple things that help us in thinking whether this is criteria of a disorder needing treatment versus situational anxiety, which is common and does not need treatment.
Hmm.
So I think making sure that we have the accurate diagnosis is very, very important because we don't want to start a treatment for situational anxiety ever.
Hmm.
We really want to treat anxiety disorders.
What's
Generally,
the danger? Sorry to cut you off. The question is
sure,
going.
sure. So there's a couple dangers. The first is depending on how the anxiety is treated. If you turn to something like medications, which is very common in a primary care setting, for example, if someone screens positive on a depression screener, or if someone does do an anxiety screen and is positive, or if someone's concerned for anxiety, then it's not uncommon, and I see this a lot, that primary care doctors will start a medication for anxiety. And we know that psychiatric medications are passed in the breast milk to the baby if the mother
Mhm.
chooses to nurse. And we also know that medications have side effects. And so the dangers of medication side effects are are really important, but it's not just the medication side effects. We also worry about the labeling, for example. If someone now has an anxiety disorder, we could be causing harm just by giving them the wrong diagnosis.
Okay.
So there's a couple harms there if we miss it
Mm.
or give the wrong diagnosis. But the way that I think helps some of the patients is really normalizing how common it is, that
Hmm.
it's not just them. I think very often women shy away from expressing their feelings outside their immediate network. And it's hard to bring up struggles, especially in a culture that really values this perception of a person who can do everything, raise a baby, clean the home.
Yeah. Drinks
You
enough water every day, right?
Yeah.
All that goes to the gym. Yeah.
So I think once people understand how common it is, that
Mhm.
really helps, and it's a breath there. Also, a lot of times people are afraid that if they say something, they'll be put on medications. And so saying there's multiple ways of treating, there's multiple sort of ways we can think about improving the anxiety. You can think of it almost as a ladder. There's a couple rungs. You don't have
Mhm.
to, and you can approach from a couple different ways. And so whether it's talk therapy or whether it's relaxation training or whether it's you work with the patient. So I think getting them to a point where they want to tell you what's really happening for them because they're not afraid of what you might do in response. And
Mhm.
that's hard. Generally it happens better if there's already an established relationship. So
Mhm.
the
Yeah.
primary care doctor, for example, has an established relationship, much easier to pick up on it than if it's someone who's seen the patient, twice.
Right. Yeah.
And
There
with the
is. Oh,
screens,
sorry.
sorry,
So
go ahead.
sorry.
No, with the screens, a lot of times people are not going to maybe say what's truly affecting them on a screen that's given to them in an office. Sometimes it's accurate, and in some cases, if you directly ask, you might get a different answer. So that's
Right.
something I have noticed in working in primary care. The screens are
Yeah.
not always accurate.
It makes perfect sense. Yeah, I myself am on medication, and the first step was filling out a questionnaire about anxiety and depression, and there's this like impulse to lessen it, and I don't know where that comes from, but it's exactly what you're describing, like on the aggregate. That I don't know. I guess not wanting to be seen as a complainer or something.
Yeah, yeah, or weak or not able to handle it. And it doesn't help that it's very easy to turn on the television or to open social media and to see people who are posting their best days.
Mhm.
And we do compare ourselves to other members of society, and some people might not have the same support networks or the same amount of hands to help out. And so there's huge variation, but you might only see the positives.
Right. In
And
fact,
so
you
I think this
definitely
is,
are. Like,
yeah.
yeah. I just think of the last time I've ever posted something negative on Instagram. I don't know when that was, but yeah, it's just, and that collectively weighs on us.
And I think this podcast really helps. I mean, the this is extremely common. This is common stuff we're talking about. We're
Yeah.
not talking about a rare zebra. We're talking about what's affecting a lot of women. A lot of people have given birth and a lot of families and a lot of members of families.
Hmm. One of life's mysteries is that birthdays always find me unprepared, catch me unprepared. I don't go on Facebook as much, so I don't notice them as much. But I want to express my love and appreciation for friends and family. That wasn't part of the copy. I'm just saying it. Year after year, month after month. Even when I see it coming, I'm not ready. Am I a jerk? Yes and no. Why do things have to be so black and white for you? But I've got great news, friends. Introducing monthly card subscriptions from the Cardist studio. Join the service that delivers the card and the stamp that you'll need to your door. No more errands. Who wants more errands? I don't know why, but I'm starting to think of errands as a kid's name. Errands, go back to bed. Okay, but here's how it works. You choose your categories, from birthdays and celebrations to love and encouragement, or select their full collections and have those thank you notes and just because cards at the ready. Those ones are always so nice. Like when you get a card for doing something and it's just like a small little heads up or token of appreciation, it genuinely makes you feel really good. And best of all, you would never get caught cardless again. Let me repeat. You'll never get caught cardless again. Try to say that a bunch of times in a row. You'll never get caught cardless again. Monthly card subscriptions from as little as $8 per month for the card and the stamp. Delivered to you. TheCardistStudio.com shop subscriptions. And you can use the promo code AnxietyPod for 15% off your originating order. And I love mentioning the support person in the relationship too, that like they can definitely experience that. Is that somewhat relevant or I'd imagine it's not as common as someone who actually gave birth, but do you have any idea about how prevalent that is?
So probably less, you're right. For
Mhm.
both of them, we don't know
Mm.
because it is so underreported, so underdiagnosed. So so yes, probably less. And then the hormonal components, of course, might be different.
Hmm.
But we do know that postpartum anxiety doesn't just affect the person who delivered the baby. We do know it affects family members, caregivers, and not just after delivery of a baby, also new parents in general, parents who decide to adopt. Also
Mm.
very common to have postpartum anxiety.
Oh,
So,
wow.
so it's not just the physical piece of giving birth.
That's so interesting in that. I mean, you it's something you know without knowing, but actually thinking about how the brain might change without physically giving birth. I mean, when you take a child into your home, I've seen it with people who have adopted, right? They become parents immediately, right?
Yeah,
It's just the
yeah.
brain is amazing in that way.
And you're releasing new hormones, you're cuddling and you're worried, you have stress hormones going on because it's a new experience. And so there's a lot going on physiologically too.
Yeah. Well, it's like so many, there's like classes and different things that people take when you're adopting or having a child. It's like, why isn't, or maybe it is, but why isn't this like baked in there somewhere that like, hey, this is might be something that will happen to you, and here's what to do if that arises.
That's an excellent question, and I hope with time we won't have to ask that question. I do hope that that's incorporated because it's such a big piece. Just knowing you're not alone can be so
Mhm.
helpful.
Right. Yeah. No one wants to feel like they're the, I'm using air quotes, like the
Mhm.
crazy person or the person who's having the hardest time, you
Or
know.
we, or yeah, exactly, exactly.
Yeah. Well, I really enjoyed this conversation. I just want to make sure, is there anything you think I'm missing or anything that you think is important for us to mention
Well,
here?
I'm just thinking about what can someone do who's struggling with anxiety,
Yes.
who doesn't need to go to sort of the higher level of care. If the symptoms are moderate
Hmm.
or mild, what can be done just to relieve the anxiety? And I think, the sleep piece is good. Anything you can do to optimize sleep, but that's easier said than done.
Right.
So babies will have to feed every couple hours. So what else can be modified in the home? So can you minimize interruptions from older siblings or a partner who's snoring or have a family member take the baby out so you can get a stretch of sleep? If someone's eating every couple hours, it's very hard to get a longer stretch of sleep. So really thinking through in the family environment, what can be done to at least have one stretch where it's more than 2 hours. I I like to shoot for the stars and say try to get a 4 hour sleep just uninterrupted, which
Yeah.
sometimes you can't do, and that's fine.
Yeah.
But at least to sort of shoot for sleep and really having everyone focused on that as goal number one. And then what can help decrease anxiety is actually back to sort of some of the hormonal stuff, putting the baby skin to skin. So really stripping the baby down to the diaper, putting them on your chest can really help sort of with the oxytocin and sort of the cuddle hormone, really help relax. So optimizing skin to skin, it has other benefits too. It can help with a nursing relationship and physical activity. Again, for someone who's struggling with anxiety, it's hard to add things to a plate. It's hard
Hmm.
to say, why don't you go see someone, talk to someone? A lot of times there's no extra hours of the day.
Yeah. One more
There's
thing to feel crappy about, right? Oh, I didn't work out. Yeah.
exactly. So it doesn't, I mean, what I like to think about is, well, at least get outside the house. You
Hmm.
can wear the baby in a baby carrier and take a walk. So
Hmm.
you're not apart from the baby. You don't have to ask anyone else for much else, but just to make sure you're not staying in your room with the baby 24/7. So I think the physical activity is actually more doable sometimes as long as it's okay to bring the baby.
Right.
So I do. We know that aerobic exercise really decreases anxiety, decreases depression symptoms, decreases stress hormones, and it doesn't have to be a lot. It doesn't have to be going to the gym three times a week. It can really be that walk outside, being in nature, and then sort of individualizing what helps relax a person. So there, people really differ. Some people prefer music. Some people prefer a partner massage. Some people prefer a relaxing cup of tea. I don't know, a
Yeah.
bath. So that's really where the individualization helps too. What worked before probably will work again. And then if they want to, they can try, listening to an app, or they that's an option as well for some people if that's what they choose to do. But I
Mhm.
wouldn't recommend it unless it's what the person wants to do.
Yeah. That's all great advice. It seems just another reminder of like getting to know yourself. I mean, listeners of this podcast have heard me talk about how I didn't consider my mental health until like 3 4 years ago, and now that I've gotten to know myself and learning the things that help me calm, like
Mhm.
yoga or making prioritizing exercise and sleep and all those good things, if you don't know those things,
Mhm.
you're gonna have a harder time calming down. So yeah, it's good to know yourself in that regard.
And you can do a little trial and error. It
Yeah.
doesn't take that much time to make a cup of tea or
No.
to take a bath or listen to
Yeah.
some calming music. So you can play around there a little bit. Hopefully that's more sort of fun homework.
Right.
But the other thing I think that's important is some people do need medications.
Hmm.
And then the question of risk benefit. And yes, there are risks to medications, but there's also risks of untreated anxiety.
Hmm.
And so when weighing those, and this is something a person will do with their doctor, but not to necessarily forego before having that discussion, because I think it is less well known how strongly anxiety can affect the mother baby duo or the father baby duo or the family member baby duo.
Hmm.
So untreated anxiety makes the person caring for the baby a little bit less reactive, perhaps, or hypervigilant, and that can have downstream effects for the baby. So not treating also is a risk.
Right. And then as they grow up watching your behavior, right, they'll learn anxiety
Yeah,
if you
yeah,
don't have yours, just generally speaking, if you don't have your mental health in order, right? Because kids watch everything we do.
yeah. The other thing is that it doesn't necessarily, so when we talk about anxiety, it doesn't have to be right after delivery of the baby. So it could be any time during the pregnancy that it could start. It might start after delivery. It might happen much later. So we think of postpartum anxiety as within the first year. And it
Mm,
might not be until a person decides, to wean from breastfeeding, for example, that they have their first anxiety episode. That's
mm.
still postpartum anxiety, but that's delayed by a few months from the delivery, and that's also just to know about
Yeah.
when
Yeah,
thinking about recognition.
that's all amazing advice. Thank you so much. I'm wondering if there's anything you want to mention in any social media or anything you'd like the audience to look at.
So if someone is wanting to know more about medication options, for example, because this is a specialty field, there's an excellent website, womensmentalhealth.org. I'll say that again, womensmentalhealth.org, and it will basically answer every question, and it's extremely evidence-based. It's a very well done website. So
Awesome.
that's
I'll
where I
include that
actually
link
refer
in
a
the
lot of
description.
my patients to take a look.
Oh, great. Yeah, I'll definitely include that link in the description. So wherever you're listening to this, you'll be able to just click away and be there. Yeah.
Awesome.
Well, thank you so much for your time. I've really enjoyed chatting with you, and this is all such valuable information.
It's nice speaking with you. Have a good rest of your day.
You too. Man, I'm beginning to think that a pregnancy is a lot, huh? But yeah, very interesting that we don't have the tools or the protocol to sort of address postpartum anxiety. So that's certainly something to be mindful if you know someone that's pregnant or has given birth within the last couple of years. On top of just the normal anxiety of like, oh, now I have this tiny human I have to keep alive and happy and try not to pass off my anxiety onto them. Well, thank you so much to Stephanie. Before we get to the weird thing causing me anxiety this week, I just want to remind you of the Buy Me a Coffee link. It's a way to make a donation to the show, a tip, if you will. Then there's the Pure Spectrum CBD partnership I have, who offer 15% off with the promo code AnxietyPod. Speaking of AnxietyPod, the Cardist Studio also offers 15% off with the promo code AnxietyPod. 15% off your initial order. So yeah, check them out. Send a sweet little card to a sweet little somebody. Or send a mean thing to a mean person. Or a mean thing to a sweet... No, that one doesn't work. And then there's, if you want to sign up for home delivery for groceries, there's Instacart. By signing up in the link in the description, you're telling Instacart that this show sent you, which helps support the show, which you may feel inclined to do. Okay, so the weird thing causing me anxiety this week. I mean, it's pretty much every week. Because when I'm recording this part, I'm alone in my office. I'm talking to myself. I'm laughing at my own jokes. And Jamie's here, right? She works here. She's got an office. She lives here. She works here. This is our house. She lives here with me. But like sometimes I'll hear her like coming up the stairs, or I'll think I'll hear her, and I'll just like get quiet and get nervous. It's just embarrassing to be like talking to yourself and recording a video of it. So I try to record these when I hear that she's in a meeting. It's just embarrassing. You feel like a loser. But yeah, that's what is on my mind when I'm like right behind my eyes every time I've recorded this. I'm like, oh shit, what if she's coming or she hears me? I haven't worked through that yet. Well, there's always next week. As always, thank you so much for listening. Have a great week, and I'll talk to you on Thursday.